Hello, everybody. Thank you for listening and watching the Healthy Project podcast. I'm your host, Dion Lewis. Today, man, what we're going to be talking about with Dr. McCauley, physical therapist that works on something. So, to me at the time, not that be very specific to a lot of people, but it was very new to me when we talked about it.
Yeah.
Um, Ehlers-Danlos syndrome. For our conversation today, I'm just gonna say EDS
Okay.
for short.
Yeah.
For short, and some of the disparities around that,
Yes.
and why we should be talking about it more.
hmm
So thank you so much for sitting down with me. I appreciate it.
Yeah. I'm excited to be here.
Yeah. So before we get into EDS,
Yeah.
tell me about you.
Yeah.
Like, what drew you to physical therapy? What does helping people with these experiences, what is that like for you?
Yeah. So I grew up small town Iowa, went to the University of Iowa, got a degree, had always meant for physical therapy, but decided to get some experience before I went back. So I became a physical therapist because I actually had the chance to work in a clinic with spinal cord injury clients after they were injured. And I really saw the way that helping them gain back movement and life, um, I don't just benefited them. And I wanted to be a part of that. I've always been a big movement person. I was in 4 sports. So I think a lot of times, usually when people get into PT, the first thing
Yeah.
they think is, I'm going to go into
Yeah.
sports PT.
Right.
But the more I dove into PT, I saw all the different areas that we could help people. And I like that diversity. That also just suits who I am. I love being able to help in so many different ways. And really the quality of life is a big deal for me. So I want to help increase the quality of life of people. So that's really what drew me to PT.
Yeah.
Yeah.
And to your point, and then before I knew more, when I thought physical therapy, I thought, oh, sports
Yep.
injuries, things like that. But there's so much more
Yeah.
as I've learned.
There's actually 9 different specialties. So,
Yeah. So that's really, really cool.
yeah.
What was it about? When did EDS first come across your radar?
Technically, when I was in school, I heard about it. It was part of a lecture. They talked about EDS. And so I was like, "Oh, okay, interesting." And so when I was in school though, they were like, "This is really rare. You might see it a little bit when you're in practice, but it's not something you're gonna see a lot." So
Right.
I didn't really focus on it. But it really became apparent actually when I first started my job, back in 2023. They had just done a hypermobility workshop at our clinic where I work at Kinetic Edge Physical Therapy. And so when I came on, we had all of these clients who are hypermobile um, come to me, but a lot of them had EDS or Ehlers-Danlos syndrome.
Oh.
And so I was pushed right into it. And so that's really yeah, that's how I started, but I liked it. It's different than treating other different types of clients who come in for physical therapy because instead of it just being an injury, it's actually about lifestyle management, and that's really interesting to me. I like doing working with that.
Yeah. So let's break that down because when you say sorry,
Hypermobility.
hypermobility.
Mm-hmm.
Um, and there's a difference between that and EDS.
Yeah.
For somebody that doesn't know that difference,
Yes.
what is Danlos syndrome for
So
someone that doesn't know for the first
yeah,
time?
so it's considered a connective tissue disorder. It comes from your genetics, and so that's a big part of where it starts. And so, really, Ehlers-Danlos syndrome affects all parts of the body. Connective tissue is all throughout your body. It's not only in your musculoskeletal system; it's in your
Mhm.
cardiovascular. It's in the nervous system. It's part of your GI system. It's all over. And so it affects them in many different ways, where someone who might just be a little extra mobile doesn't necessarily have that. But with Ehlers-Danlos syndrome, they have so many other different comorbidities that come along with it.
Mm.
As a PT, my job is to treat them musculoskeletal, but I need to also be aware of all the other things. And so that's really the big difference is
Right. And how is that first diagnosed? Like someone maybe growing up thinking, oh, oh, Danny's just flexible, but like
Yeah.
he may have EDS. Like, what does that road to diagnosis look like?
Oh, it's actually usually a long road. As of right now, it takes about 10 to 12 years to get diagnosed.
Really?
Mhm. Yeah, because a lot of times what people will have is they'll have one symptom here and then another symptom there, and a lot of like your PCP or your primary care physician, they're amazing because they are there for you to really get you on the right road, but they don't necessarily get to see all of that connection.
Mm.
And so it comes with all of these specialties. They might send you a cardiologist or rheumatology or an allergist. And it's not until they're all talking and we have good collaborative care that they start to realize maybe there's something bigger here. And that's when it starts to head towards that like EDS diagnosis.
Yeah, but like
Mhm.
what man, that's a long time.
Yeah.
What can happen in between that time with all the comorbidities that you're talking about?
Mhm.
Like, what is happening during that time and from the time they get it diagnosed? Like, what damage has been done?
Yeah, that's a great question. So really a lot of it I would say is the pain that someone's enduring.
Mhm.
And kind of from the PT realm, a lot of people stop moving, they stop it really affects their daily life, how they're engaging with things. And so I would say that's the biggest thing is really their quality of life is extremely impacted. Some people have it will impact their life so much that they can barely get up every day or they can barely tolerate doing more than like showering and walking to the bathroom to and from the bathroom. So it can really range on how it impacts you, but for some it can really
Man,
cause a lot of I wouldn't necessarily use the word damage, but impact.
right.
Really impacts their life.
Man.
Yeah.
There's this term that I read. There's a phrase from the community
Yeah.
that EDS is not a white person's disease.
Yeah.
Why did that need to be said out loud? And,
Yeah.
and what does the research actually show?
Yeah, that's a great question. So EDS is still relatively new. Um, and that's part of the reason, like, even today, there's gonna be questions you might ask me, and I'm gonna be like, I'm not exactly sure."
Mhm.
Because they're still figuring it out. It's really grown, I would say, probably in the last, like, decade to maybe last 2 decades, which is not that long. They're starting to study this more. Part of the
Okay.
reason they say it's not a white person's disease is when they do research, pretty much all come from a Caucasian or white community. And so they don't actually know the impact that it's having on other communities. So
Right.
yeah, and I would say the other reason is pain is really diagnosed alongside of EDS, and research has actually shown that sadly physicians, specifically within the Black community, it's about I think it's 47% of those who say that they're in pain, the physicians just kind of dismiss. And so it's really helping show that this is not just a white person's disease, that there's more people impacted currently in every community.
Yeah, and it's funny you say that. So, and I think you may have sent this to me. There's a story from the EDS Society about
Mhm.
a black woman named Mia,
Yeah.
and her years long road to diagnosis.
Yeah.
Like you said, 10 to 12 years. Like, yeah, right. When you read stories like that as a provider, what do you take, from them?
I think really just as a provider, I think one realizing the impact that we can have on someone just
Mm.
by truly listening.
Man,
Because I think that's probably the biggest thing is if someone was listened to and paid attention to a little bit more, I think more could have been done. I think she actually even pointed out that that 10 to 12 years actually is for people of the white community, a white person. If you are of another ethnicity, specifically even within the Black community, it takes an extra 4 to 6 years to get diagnosed.
wow.
Just because there's so much like pain is dismissed so often.
Man,
Mhm.
and like, and what is so cool, and I want to talk about your profession a little bit because one, as you know, my daughter still wants to be a physical therapist.
Yeah.
That is her vibe.
Yes.
Um, and yes, it's great that we have allies like yourself that are like, hey, this is something that's happening.
Yeah.
This is something that needs to be talked about more.
Yeah.
But physical therapy has some of the least diverse professions.
Yep.
It's one of the least diverse in healthcare.
Yep.
Why do you think that is, and why does that matter for patients that are going for physical therapy or PT care?
I think part of the reason is, I would say, one, exposure. Um, I would say overall, in terms of the medical professions, PT is still not referred to a lot. And
Mhm.
so as I think about care within the Black community, they might, well, I can probably say I don't see people in the Black community as much in my practice as I would hope to. And I know, especially with what I hear, the pain that
Right.
is being dismissed, I know there's so much more as a physical therapist we could do for them. So one, I think referral and exposure. Um, and then I think the other thing is even just mm, there's I would even say, PTs, although we're in the medical profession, we're not necessarily surgeons, we're not
Mhm.
doctors. And so depending on what people are striving for, it might be a little bit different. So I would say that's probably it, but I guess I couldn't really 100% say for
Yeah,
sure.
no, I 100%
Yeah.
understand what you're saying, and, like, one, I will say too, like, I feel like a lot of not even people of color, but anybody in general, I don't think they understand what a physical therapist can do for them.
Yeah.
I don't think they understand they can ask. They may not even need a referral to see a
Yeah.
physical therapist.
Yeah.
Um, they're just waiting for the provider to tell them to go see physical therapy. I go there when I have like I said, for sport, I have an injury or I
Yeah.
have the rehab on something.
Mhm.
They don't know that they can utilize you for other things.
Mhm.
And why I think it's so cool and why I was really was excited about doing the episode was like, I don't think there are people that know they're allies that say, hey, I don't think they know there's an Emma out there that's like advocating for them that says, hey, this is what I can do for you if you have these things. And hey, it may not be EDS, but you don't know until
Ex-
someone listens to you and
Yeah.
you go through the process.
And that's one of the things I would say that I do like about physical therapy compared to some other medical professions is we have a greater amount of time that we get to spend with you than most other medical professions. And so we are able to listen. We are able to ask a little bit more questions. And I would say even the big thing, and part of the reason we became doctors or went into the doctorate like level is so that way we knew where to refer people if PT
Mhm.
was not the right place. Um, yeah, I think that's really, really important. I forgot to answer part of your last question too. I think representation matters
Mhm.
within um, the PT profession because sadly it is still shown a person of your community, if they're in that profession, you're more likely to get better care.
Yeah.
And I'm definitely for health equity. Like I want to see everyone getting good care no matter what care it is. Um, so I think that that's really important.
No, I
Yeah.
love it.
Yeah.
I think it's so true. I wanna go back to patient comes, sees you, that I saw some pictures of people pulling their skin out, I was like, "What is going on here?"
Mm.
You see them, you're like, "You have EDS," right? Right? When you start to help them with
Yep.
your PT, what are some of the changes you're seeing
Yeah.
as they're improving? Like, what does improvement look like?
So, first of all, one of the biggest things I would say is awareness of the body. So, when someone has EDS, they have a lack of this term called proprioception. Proprioception is this term meaning knowing where you're at in space. So, they tend to be more clumsy. They're
Mhm.
bumping into things. They sprain their ankle more because maybe they're just not aware that they're stepping off of a ledge, things along those lines. And so, proprioception also is what tells us how far we should be going through a range of motion at a certain joint in our body. And someone who's hypermobile lacks kind of that stopping. They can go further than most people. So they have no idea that they're going into a greater range of motion than someone else. And so I would say that's probably the first thing is like awareness of the body that, hey, maybe you shouldn't sit that way. Or if you're a baseball player, hey, maybe if you're throwing, you actually shouldn't be reaching back that far. Or, um, so I would say that's a big part of it. It's really looking at like daily postures. And then the biggest thing I would say is something called stability. So in our body, we have different types of strength.
Mhm.
Okay. We have very generalized. We have two big types of muscles. We have major movers and we have our stabilizers. And so the example I always give with major movers is that if our arm is supposed to go up and down like this, the major movers are actually making that happen. Okay. The stabilizers make it so it doesn't look like this. So
Gotcha.
it's keeping it. Um, and a lot of times with people who are hypermobile, they don't have good stabilization. They're lacking stabilization at that joint, which is actually what causes pain. Now, not everyone who is hypermobile has pain. I'm actually an example of that. I'm actually hypermobile. I actually didn't realize how hypermobile until I got into this realm. Um, but I've been very lucky that I didn't have a lot of pain.
Right.
And so I'm lucky enough that my stabilizers do turn on. I can attribute that personally, I think, to because I played 4 sports growing up. I'm very aware of my body.
Oh, right.
But a lot of other people don't have that. And so that's what I'm there to teach them. And I can't tell you how many tell me they feel like they're a baby giraffe learning how to walk again. So yeah, it's very
Well,
interesting.
yeah, I can only imagine when when you're just doing your normal thing and you're like, well, you're doing it wrong, and now you gotta like
Uh-huh.
try to figure it
Yep.
out. So, like I told you, my son has super high arches and things like that. So when we're trying to say, hey, you gotta fix your walk, he's like, he's trying.
Exactly. Yeah.
It
It
like
feels awkward.
yeah, it feels awkward and it's like I don't laugh at him anymore. I'm like, bro, like what are you doing? I'm like, okay, he's just used to walking one way that was comfortable. We're
Mhm.
trying to change that.
Yep.
So yeah, it's gonna look different right now.
It's gonna look awkward.
It's
It
gonna look
will, and it'll
awkward.
probably feel awkward.
Yeah.
That's one of those things that I tell people. I'm like, this doesn't feel right now, but later on, our body is amazing at learning things. We have this term neuroplasticity, which is
Mhm.
the ability to learn new things. But a lot of times we have to create a new neural pathway to make it happen. I always use the example of like if it snowed, you made one path to your car, but all of a sudden you realize you now need to go to your shed. And
Mm.
it takes so much energy to get to this new pathway, and it's the
Yeah.
same. It takes a lot of energy, but once you do it time and time again, you've learned it, it starts to feel normal and you start to be able to do it better.
Right.
Yeah,
One question I have, just as we're talking about, Bambi and being able to stabilize, what does, EDS look like in like an aging population? Like what does longevity
great
look like
question.
in it for those individuals that you serve?
So that's really what they're starting one of the things they're starting to run into is this is a genetic thing. When
Hmm.
someone comes in and so as a PT, I actually can't diagnose Ehlers-Danlos.
Oh,
It
right.
has to be through a different, but I usually can send them on their way to say these are what you need to do to get potentially diagnosed and figure out if you have it. But I'm like, if you have it, there's a solid chance either your mom or your dad or both have it.
Got you.
And so really looking into that a little bit more and so they might come to me, let's say their parents be like, "Yeah, I've always dealt with I just assumed everyone had this pain every day."
Oh, right.
And it's like, "No," but once I test them, their hypermobility isn't as much there because you do get stiffer as you get older, which there's a pro and a con to that. There's different reasons. I can really get into that, hormones and all that junk. But um so they may not show as hypermobile, but are still
Hmm.
dealing with the pain.
Right.
So and they might still have the other comorbidities that come along with it. When I talk about other comorbidities, there's things like GI issues. A lot of times they have some GI pain. There can be cardiovascular issues, which is part of the reason it's really important. The first place I send people is a cardiologist
Oh,
because I want to
no.
make sure things are okay there. And then last but not least, it actually really affects our nervous system um, and other areas. But that's really important because that can actually influence your ability to engage with everyday life with like anxiety and depression,
Oh,
actually. And so digging into that, there's actually a correlation with neurodivergence and hypermobility. So a lot
really?
of people who have hypermobility many times also are neurodivergent. And so helping with like engage with that and sending them off to a mental health provider saying, hey, maybe this might be something else you need to look into.
Yeah.
So yeah.
Yeah, just by talking to you, and it feels like you fell into like your passion. Like this is like it's who you are, and being able to help people. That's really really fun to see. Like as you're like talking about these things,
Yeah.
um, what is it about this space that you're like, this is just I not necessarily you are physical therapy, but like this is it seems like it
Natural.
comes so natural for you.
Um, yeah, that's a great question. I think for me, Um, I I enjoy connecting people to a way that's gonna allow them to experience life better. I'd say that's probably my biggest, like, goal in life is just to be able to experience as much as life as possible, And so seeing these people who are so limited or even think that because they're in pain that they can't do things, I love to help them find ways to still experience life. So a lot of times in the American society, we are 0 to 100.
Damn.
We are 0 to 100, and that's how a lot of times people who have EDS really struggle with that because they feel so less than. And I'm like, "No, no,
Yeah.
no, there's still so much you can do, it's just gonna look different."
Right.
And so helping them see that, like, if we make this modification, you can actually still do this. If we make this modification, you can actually still do this. And so I think that's really where I become passionate about is like I don't want people to feel like things are impossible, that there's hope.
Right.
Honestly, that there's hope for them to be able to still live life the way that they want to.
Yeah. No, I
Mhm.
love that. And
Yeah.
is there like for someone who's experiencing or has EDS, is there like are there things they have to do at home? Are they seeing you, but are there still things that they have to do? I can only imagine this is like something once you start, this is it. There's no 2 weeks and you're good. It's like a
Yeah. And that's what I mean by lifestyle management
yeah.
is I tell them like my job is to work myself out of a job.
Mm,
I truly believe that. My we use this term plan of care, which is how long you see someone.
mhm,
Technically, how long I see people is a little bit longer plan of care for someone with EDS, but the amount of times I see them might still be the same amount as someone who has an ankle injury. It's just because I'm spreading it out. Because I'm helping them make those lifestyle changes and figuring out how do I do this and how do I adjust it for them? Because not, especially in this population, usually the first time we do it is not the right perfect correction, I guess I should
right.
say. We need to kind of adjust it for them. And so it's like try this out at home, maybe try it for 2 weeks and then we'll see. So that's really where I'd say is like the big difference with them is it is I usually send them on their way with some resources. Now sadly insurance will only pay for so long. So I will say that PT is something that usually they need to have on their care team.
Mm,
And so throughout the rest of their life, they probably will be seeing a PT at certain points. But I wish I could see them all the time, but
right.
our insurance is not necessarily that in that preventative realm. Yeah.
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 Yeah. We that's a whole different
I was gonna
episode.
say that's a whole
That's a
other
whole
conversation.
that's a whole different
100
conversation.
yes. So, yeah.
Yeah, I wanna go back to, the story from Mia who
Yeah.
said, people of color, they say 10 to 12 years, but maybe people of color, it may
Mm,
be 14 plus or
yeah.
longer. For somebody that is, say, they're listening to this episode, they're like, I do have this pain. A lot of the things Dr. McCauley say are things that maybe I'm experiencing. What is that next step for someone that wants to eventually see a physical therapist? Can they come directly to you?
Mhm.
Is there a step they need to do first? Like, what does that look
It's a
like?
great question. So in Iowa, we actually have we're a direct access state. So for the most part, with most insurances, you can go directly to a physical therapist. The ones that are commonly you always have to get a referral is if you have Medicaid or Medicare. You always have to get a referral from your PCP. Most PCPs are open. If you ask them, "Hey, I have pain. Can I go see a physical therapist?" They'll be like, "Yeah,
Mm,
you know,
right,
I'll write this for you so you can go see them." Um, yeah. So for the most part, there's a couple insurances here and there, but those are niche. And so
right,
for the most part, it's pretty easy to go to a PT.
right.
Yeah.
Somebody they can just call up, hey, Kinetic Edge.
Yep.
I want to see Dr. McCauley. Let's
That's
do it. And that can not just be, it's not you only
no.
do EDS. They can do it for wherever they need physical therapy
Yeah.
services
Yeah.
for. So that's really, really cool.
Yeah.
Dr. McCully, thank you so much. For those people that are listening that want to learn more about you, learn more about EDS and the things you can do, where can they find you? Where can they reach you?
Yeah. So I actually work at Kinetic Edge Physical Therapy, which is located on 6,000 Grand Avenue. It's kind of down near the Sands or Valley Junction area. So that's pretty easy. You can call up our phone number. Otherwise, you can do Emma M at kineticedgept.com. You can email me. Yeah, those are the best ways to get in contact
Awesome.
with me.
And I'll make sure I have those resources in the description of this episode. So make it easy for everybody, and the links to the resources you sent me. I think those would be very important for the audience to
To be able to
kind of
really
read those. That'd be really, really cool. Dr. McCauley, thank you so much for being here. I
Yes,
really
thanks for having
appreciate
me.
it.
I appreciate
Yes.
it.
Everybody, thank you so much for listening to the Healthy Project podcast. I'll holler at you next time.